Hey y'all, welcome back. I'm Mama Dr. Jones, a board-certified ObGyn and mom to 4, and today we're discussing Ethan and Hila Klein on the H3 podcast announcing that they are pregnant with either twins or triplets after infertility treatment. As a twin mom and ObGyn and YouTuber, I could not be more thrilled for them. I'm excited to answer some of the questions that they brought up on their podcast because I think there's a lot of learning to be had, and I think it's really great that they're discussing this publicly. If you're new here and you'd like to subscribe, we'd love to have you. We talk about all things periods, pregnancy, sex ed, gynecology, whatever you can think of in that space. So if you're not interested in learning about those things, then don't subscribe because you're definitely going to leave with information to share with your friends. Let's jump into it. Hey y'all, Editing MDJ. I just wanted to add in here that since I filmed this video, Ethan and Hila have announced that they are expecting a singleton and not twins or triplets, which is still equally exciting. I wanted to share the video still because it has some really great information about twins and triplets and answers a lot of the questions that they had on the podcast. I am not becoming a beauty influencer, and this is not a smoky eye tutorial. My 4-year-old Buzz Lightyear into my face last night while I was trying to sleep and gave me this lovely smoky eye look on one side. So yeah, I do have a black eye. Thank you for asking.
So you're a baby factory? You want to tell me about like the story of how you found out?
So I went to the ultrasound without Ethan because up until now, because of COVID, they made me just go by myself. But
I'm not allowed.
Now they said it's a different story, so next time you can come with me.
So just quick interjection to say I stand changing the procedures when science makes that possible. I strongly believe that if you're vaccinated, and they've talked about it on the podcast, that you should be allowed to bring a family member with you to an event like an ultrasound.
It was kind of shitty not to have you there because I was like shaking. I was like, oh my God.
Yeah, when you called me, you were hysterical.
So they did an ultrasound and she was like, well, I see 2 circles. And I was like, oh, shit. And she was like, yeah, one looks good. The other one also, I think, looks good. And then she was like, and there may be a third one. And I was like, what?
Every time I have to tell a patient this, it is like this same reaction, and having been through that with my twins, it was like shocking. So for me personally, I was sitting there and they were scanning me and I was like, excuse me, is that 2? And the ultrasound tech was like, I have to wait until the doctor comes in. I can't tell you anything medical because they're not supposed to, but I could see it and I was freaking out. So she left and I told my husband, this is your fault. You prayed for this. You wanted twins. Obviously, we were very happy, but it was very shocking at first. They were doing fertility treatments, but even when you're doing fertility treatments and you know it's an increased risk of twins or triplets, you still expect that you will fall into the 90% of people who just get one.
Hila's turned into like...
I'm like an eating machine.
She can't stop eating, bro.
I can't. I'm right now, like I was having anxiety about how am I going to make it through the podcast without eating.
I know.
The podcast.
We might have to just give you food.
I tried to like eat just until the last minute.
You want some chips?
But do you understand how unusual this is? Even
It's
during
so
the last pregnancy, you weren't like this.
No. It was like, oh, I'm enjoying a slice of pizza, where before I didn't even enjoy it.
So yeah, the hormonal changes of pregnancy are often significantly higher when you have multiples. So you have higher levels of estrogen, progesterone, and HCG, or human chorionic gonadotropin, which is what's in a pregnancy test, what we test for in a pregnancy test. And those combinations of hormones do increase appetite. So when they are increased exponentially, they can exponentially increase appetite as well. The hormones can also greatly increase nausea. So this is why things like hyperemesis, though that can happen with any kind of pregnancy, are more common in pregnancies that have higher levels of those hormones, specifically twins, triplets, higher order multiples.
Panicking because she's going to be forced to sit here for whatever many hours and not eat.
Yeah, I told Ethan, like, yesterday I was just like snacking at the office. Like I ate 2 Kind bars. Like nothing. And for me, before, eating 1 was like impossible. I would never finish 1.
I find that so funny because for me, I was like 2 Kind bears. That's like a warm-up. That's like a stretch for me.
They're heavy.
No, they are. They're heavy. That's like 600 calories.
The calorie depleting effects of growing a baby vary by what trimester you're in, but also rely heavily on how many babies you're growing. And that's because the metabolic requirements are exponential depending on how many fetuses are growing in the uterus. But most people need less calories extra per day in pregnancy than has traditionally been thought. We've traditionally said, oh, you're eating for 2, but it's not quite eating for 2. It's eating for you and a fetus.
So some people were saying, because when we got the call last week,
Yeah. Then
You
I was
had
super
some
pregnant.
hormonal
Right.
number.
Yeah. The
It was-
392. I'll never forget that number.
Yeah. And we didn't know what it meant, but there were some comments that were like, that's
a lot.
so high that you might have multiples.
Right.
392 is not that high depending on where she is in her pregnancy. HCG, which is the number they're talking about, doubles every like 48 hours. So, that's a good number. I would be very happy with that if I drew it for someone who was trying to get pregnant. Like, that's a solid number. But it wouldn't strike me as like, oh my gosh, that's super high. But it also is highly dependent on like what day after the insemination. Because they were doing intrauterine insemination, which is a medical procedure that puts the sperm directly into the uterus and increases the chance of pregnancy, and because she was getting those injections to help her ovulate, they know exactly the day that she ovulated and conceived. So it could be considered very high by her doctor because of the day that it was drawn. But just a random person on the internet hearing that number and not knowing any of those dates, I wouldn't say it's possible for me to say, oh, this is really high or really low. But I think in the last episode, her doctor told her it's really high. And in that case, then yes, because the doctor knows all those dates.
I mean, 1 is such a hands-on deck. 2 seems like, okay, I can see how 2 is like, I mean, people can do hard things. Like, people stormed Normandy. I can raise 2 kids. But 3, I don't understand.
How do you carry them?
Having had twins myself, I fully agree with this. Having 2 infants was so hard. And as a twin mom, I cannot conceive of how my triplet and higher order multiple parents do it. It is amazing to me. So yes, I totally agree with those statements as a mom who has twins. Twins was hard, and it was easier having singletons, but I can't imagine adding a third at the time that we had our twins.
Like, first of all, before we even get to the point of raising them, how do I walk
Yeah, Hila can't get over that.
with 3 things in my stomach?
Do you guys know, maybe one of you guys can look up, if you give birth to triplets, are the babies like lighter than usual, or are they the same?
Are they going to be smaller than if it was 1?
So generally, yes. There's 2 reasons for this. One is that even if you look at full-term twins and triplets, they are generally a little bit smaller than a full-term singleton. And the reason for that is that they just don't have as much room to themselves. But the second factor, which is usually the most significant factor, is that twins and triplets are much more likely to be born premature. So they have less time to develop and they're a little bit small. It is very, very likely that their twins or triplets will be smaller than their singleton was when he was born.
That is a good question.
Because if you tell me they're going to be the same, then what? I'm going to be like all the way to here.
Quick Google search just says most twins and triplets grow normally in the womb, but they tend to be a little smaller than a singleton baby, I guess.
Good job, Dan.
8
Singleton?
pounds.
That's what it says on this Google.
Theodore was 8 pounds. You're
We're
about
all
to have a
just singletons.
24-pound baby.
It was how much?
8 pounds.
Yes.
Right.
Exactly.
That's a 24-pound baby.
How?
And that is only counting the baby. You have triple fluid, triple placenta usually, and triple baby. You also have a lot more blood flow in your body. So the weight gain is very different, and that's another reason that the calorie requirements are very different, because it's not just triple baby, it's triple everything.
And also, you're so like tiny. Okay, so and do they all have their own placenta? Or are they sharing space? What's going on there?
So they all share space for sure. They're all shared in the uterus. The shared placenta or not, we can't answer that without seeing the ultrasound. However, because they did get this multiple pregnancy through an IUI with injectable medications to make her ovulate, the most likely scenario in this case and in general is that she has twins or triplets, which all have their own sac and their own placenta. So that would be trizygotic, meaning there were 3 eggs and 3 sperms that met and were fertilized and implanted. They could also be a combination of that, and this kind of gets in the weeds to get confusing. So we're going to talk about it in terms of twins because it can be a little less confusing than trying to bring in triplets, which adds a whole bunch of different combinations that they could be. So twins can either be monozygotic or dizygotic. Monozygotic twins mean there was 1 egg and 1 sperm, and it was fertilized, and then it implanted, and somewhere along the way it split into 2 babies. A dizygotic twin is a twin that had 2 eggs, 2 sperm, fertilization, separate implantation. So dizygotic twins are fraternal twins, and they always have 2 sacs and 2 placentas. Monozygotic twins can be any combination. If they're monozygotic, 1 egg, 1 sperm, identical, this is what we would call identical twins, if they split in the first 3 days after fertilization and then they both implant, they'll have their own sac and their own placenta, but they'll still be identical. We used to tell people if they have their own sac and their own placenta, they're fraternal, but this isn't true. If the egg splits early enough, they can still have all their own pregnancy parts. If the egg splits a little bit later than that, then they might share a placenta. So this is called monodi twins. They have one placenta, but two amniotic sacs. So they each have their own umbilical cord, they each have their own space with water in it, but they share one placenta between the two sacs. Mono twins are identical twins that split even later, and they share a sac and a placenta. This can be really, really dangerous because they have all the complications of twins in general and of monodi twins, meaning they share a placenta and there's some complications that can come along with that, but they also have the risk of getting their cords entangled. So what you want is them to not have one sac. It's pretty unlikely with the way that they got pregnant with their multiples that any of their babies would share a sac. It's not impossible. They could have gotten pregnant with 2 eggs and 2 sperm, and then after implantation or close to implantation, one of those split, in which case they could have a type of triplets that included some mono or monodi twins. That's pretty unusual. The last type of twin, which you all know, would be an identical twin that split way after implantation, and that would be conjoined twins. So you can see that the earlier the split happens in identical twins, the less they share in utero. The longer they stay identical, 1 egg, 1 sperm, 1 embryo, before they split, the more things they share, even down to sharing organs and body parts if they are conjoined twins. That was a long explanation. I hope you stuck with it.
Now I'm reading more into it. It says triplets are generally less than half the size of a singleton baby.
Oh.
Yeah.
Okay.
Yeah, that's related to the fact that they're usually born way earlier than singleton babies. Most triplets don't make it past about 32 weeks. So I mean, you should be, if you're pregnant with triplets, obviously there's a lot of triplets that make it past that. It's just much more common to have extreme prematurity with triplets.
Is it common to have a vaginal birth with 3 children, or is that like a automatic C-section?
So vaginal delivery with triplets is not common. I wouldn't call it common. There are some doctors who offer this, and it kind of depends on the doctor. I did have a patient when I was a medical student, and her doctor decided that she would have a vaginal delivery based on her history and risk factors and all of these things. But in general, I think most people deliver higher order multiples, triplets and higher, almost always by C-section. That doesn't mean it's not possible, but it's certainly much less common. Now, twins, on the other hand, it's much more common for twins to be born vaginally than triplets. The New England Journal of Medicine has a really good video about this, and I will link it in the description box below. But basically, if baby A is head down, most doctors will offer a vaginal delivery, especially in someone who has had a vaginal delivery before. So, you know, there's a lot of factors that go into that decision, but it's definitely a possibility with twins and even with triplets, but much more likely with twins.
Comment, I'm a twin, and me and my brother were both 8.5 pounds.
Yeah, but
There you
okay,
go.
so
Wow. That is some epic baby growing. I am incredibly impressed.
you're a twin, that makes sense. Like, okay, I
Like
can see how that's
2.
possible. But 3, how do you fit 3 babies?
Even 2, though, Jesus.
Oh, yeah.
Again, a quick Google search, just the top results, so I apologize if this isn't right, but most triplets and other high-order multiples are born by C-section.
Yeah, I think you're just going straight to the knife on that one.
It's still a discussion, but discussing the risks and benefits, most patients do end up deciding C-section is best. And the reason most doctors do C-section, recommend C-section, is because of the risks involved.
They're saying if they're sharing a placenta, it's identical twins. If it's
Oh, they're not
fraternals, then it's not. They're not sharing.
Holy
Placenta.
shit. Okay, so they're not identical because they're all different eggs. Identical is when the eggs split, but you have 3 different eggs.
Oh, they can already tell that?
Yeah, because of the treatment she did.
Oh, okay.
Right, again, that's most likely, but it's still possible to have identical twins when you've gone through fertility treatment. And actually with triplets, it's not super uncommon to have an identical twin set and then another twin that were originally just 2 eggs that were ovulated in 1 split. So I would say it most likely, again, is that they all have their own sac and placenta, but it certainly, we don't know that yet. And the placenta doesn't really develop until after 9 weeks, so they're just gonna have to wait until a little bit later in the pregnancy to know for absolutely sure. You can pretty well tell early on, but most likely we'll have to wait a few weeks to find out for sure.
Does it ever I was wondering, because when the egg splits, you get identical twins.
Right.
Is there ever a case of quadruple identical?
Identical quadruplets happen. It is extremely, extremely rare. I don't even know the incidence. I've never seen it in real life, but it can happen.
Identical triplets or quadruplets are very rare.
It
But
happens, though?
that sounds like it does happen, though.
Yo,
Wait,
that's-
what
so-
are we talking about?
No. This doesn't apply to you.
Dan is excellent at Googling and finding accurate and reliable information. I wish everybody had his exceptional Google skills.
Separate
Why?
into two. I was like, can you have 4 identical twins? Because I've never seen or heard of that, but you can apparently.
Crazy.
Yes, you can.
The odds are 1 in 15 million,
Oh, that's.
according to this Google
That's-
search.
That's maybe higher than I would have
I feel like
expected
they
still.
should be out. They should be bumping into them on the street. Yeah.
No, people have like no comprehension of what is actually rare. If 1 in 15 million births are identical quadruplets, that means it happens like once every 5 years or less in the United States. Like, that's super, super rare. That's incredibly rare. I mean, 3 to 4 million babies are born in the U.S. every year.
Someone who had twins, I guess, because she said my twins were 5.9 and 6 pounds, and also you waddle, and it's not easy.
Oh, bro.
Sounds reasonable.
Yeah, so I'm only 5'2". I very distinctly remember being 34 weeks pregnant with my twins, and I felt like I was bigger around than I am tall, and I would physically have to pick up my belly at night and roll it over in bed because I couldn't just like roll my body. I had to help my abdomen go with it.
But don't you think it's kind of a relief just if you have triplets to schedule a time, you go,
You know exactly when
they
it's going
cut
down.
you open, they take them out. It's like, here you go, it's done.
If it's triplets?
Yeah.
I mean, yeah.
You know.
Yeah, the reality is with triplets, it's probably not going to be scheduled. Something is probably going to happen that, you go into labor early or something comes up like that, just because the risk of complications is a little bit higher. But if you do happen to make it, pretty close to term, then scheduling it, that is, a benefit of choosing the C-section. The real reason the C-section is the most common choice is because after baby A is born, there's just a time frame where it becomes less and less safe for baby B and baby C to be inside, and there's risk of hemorrhaging, and there's risks of the baby's just not coming out or their heart rate's dropping, and then having to convert to an emergency C-section.
I don't see
The
pushing
C-section
out
is so routine
3.
nowadays too that it's.
Yeah,
It is,
C-section's
I
totally-
guess. I guess
I was a C-section baby.
you are.
Ella was too, my niece.
Yeah, no, I mean, I have friends who had it for sure. It's not a.
Happens all the time.
I was as
I guess
well.
it's just like
Zach was.
I was a
from what
10-pound
I-
baby.
a 10-pound.
I'm
Wait, you
I'm
were
gonna lay-
too, Ethan.
I'm gonna lay something on you
10.
right now.
Yes.
I was a 12-pound baby.
Get
Well,
the out of
I've
here.
never heard
No
of
way.
that.
I don't believe
I was almost a month late.
I've delivered an almost 12-pound baby vaginally. That being said, C-sections are routine to an extent, but it's still a major abdominal surgery. Now, they're considering C-section because they have a very good reason to consider C-section. There's these safety concerns. But elective C-section, although I definitely support people who are fully informed making that choice, meaning a C-section with no reason to have one when a vaginal delivery would probably be safer, is a little bit less comfortable to me, because although C-sections are routine and we do them all the time, I don't even know how many I've done at this point, hundreds if not thousands. It's still major abdominal surgery. So that doesn't necessarily apply here, but when people are thinking about having a C-section just routinely with no indication, it's something we have to discuss.
Oh, you
Oh.
were
I wouldn't come out.
late? What were the
Wow.
doctors waiting for? They
My-
should have been due.
I guess it
later.
wasn't. Well, I guess it wasn't. It was like 20 days late, something like that.
That's a lot.
The
a
doctors
lot,
let
yeah.
that go on way too long.
Well,
Yeah.
I got big as
poor mom.
big as fuck.
20 days late is a lot. That gives me heart palpitations. I'm really glad Dan's alive.
I was
it up.
thinking like, okay, I've got to raise 3 kids at once. How do I make them all feel like special and loved and attention and give them all the attention they deserve? And like, because with Theodore, he's been so much the focal point of everything.
It's hard. I mean, it's hard with multiples, but it's also really hard just once you have more than one kid. We have 4, and sometimes it can be a challenge to make sure everybody's getting the attention they need and the one-on-one time they need, but you make it work. And there's a trade-off there. Having one baby is great. They get all your attention, but they don't have siblings to interact with, which there's pluses and minuses of that too. But I think we probably overthink this a little bit. You fulfill the needs that they have, and it's got some pros and it's got some cons. You just make more room. And make sure everybody's needs are fulfilled.
But you know what I mean? It's like, how do you
How do you
bring
give
3
everyone
kids
love?
into the world at once and make them
Yeah.
all feel like individuals and loved?
I don't know. And how do you still work?
And then also giving attention to Theodore.
and those 2 punk dogs that we
Our
have.
psychotic, high maintenance dogs.
Love me, daddy.
Shredder requires more attention than our son.
Like a single baby, it's just one day at a time, right? You never feel prepared. But I understand the overwhelm, because if I thought maybe I was having 3 at a time, I would be equally freaking out. And I think even if we were having 2 at a time again, I mean, it was scary. And I think we overthink it, but that doesn't take away from the reality that it can be very scary.
Dude. Anyway, we're going to find out for sure next week, right? Because we're going in for another ultrasound.
Yeah,
You'll get to see the heartbeat.
Because she said that, it's maybe 3, and I was like, so when am I going to know? And she said probably next week.
Bruh.
Well, I'm super excited for them, and maybe we will find out soon this week. Or actually, by the time I post this, probably we would already even know what the actual number of babies in there is. At the end of the day, I'm just genuinely thrilled for them. Finally getting pregnant when you've been trying is such a wonderful feeling. So I wish them the very best. Congratulations to Ethan and Hila of the H3 podcast. If you learned something in this video, leave a like on it. I will see you next Monday.